Please welcome to the stage John Schellhase of the Milken Institute and our esteemed panel.
Hi, everyone. Thank you for joining us for what I think is going to be one of the best panels of the whole Concordia Summit. We have an incredible group of panelists here, and I'm really happy to be moderating this session. My name is John Schellhase. I'm a director at the Milken Institute, where my work focuses on deploying philanthropic capital to advance the SDGs. I'm joined on stage by a fantastic group to talk about leveraging new technology to change health behavior and improve health outcomes. I have to my right, I have Dr. Tom Achoki, who is the Senior Director for Strategy and Impact at the AB InBev Foundation. I'm also joined by Catalina Garcia, who is the Corporate Director of Global Affairs at AB InBev. And then finally, Sam Stevens, Executive Director of the AB InBev Foundation. Catalina, I want to start with you, and I want to ask you a little bit about how AB InBev and partnering with the foundation, how these two partners are working together to tackle the issue of harmful use of alcohol. Tell me about your smart drinking program and how you have framed that strategy between the partners.
Thank you, John, for the question. It's a pleasure to be here and share the stage with the incredible partners, Sam and Tom, and with you and with the audience. At AB InBev, as the world's leading brewer, we work very close with the different groups of our value chain, with the consumers, with the customers, with the suppliers, with partners, with the AB InBev Foundation. We want every experience with beer to be a positive one. So we help consumers to make smart choices. We support the customers to sell responsibly. And we are leading the way, using the core strengths of our business and investing in evidence-based initiatives to promote what we call smart drinking and moderation. This program focuses in 4 key areas. It's part of our social impact strategy. And I'm going to go over the 4 very quickly. First one is social norms marketing. It is in the center to deliver the program. It is an evidence-based methodology that uses creative marketing and social norms techniques to change behavior when drinking. So we promote moderation. We use the power of the brands to connect with people. And we're moving from just awareness campaigns to behavior change. And at the end, we feature a social positive behavior. The second pillar of our strategy is the City Pilots program. So we tested different initiatives globally to reduce harmful drinking. And we identify 3 best practices: responsible selling, road safety, and screening and brief intervention, SBI, in partnership with local experts, with the governments, with different organizations, and we're now replicating. The other pillar is around our non-alcohol and low-alcohol beer portfolio. So we led the industry by setting a goal in 2015 to expand the non-alcohol and low-alcohol beer products to represent 20% of our global beer volume by 2025. Today, our products, 4.5% and lower, represent 52% of our volume. And lastly, we updated 100% of the labels of our products in the primary packaging using evidence-based information, clear and actionable information for responsible drinking. So we develop all these pillars and these goals with public health experts, because how we work is we test first with the foundation. They follow a very rigorous and independent and transparent measurement and evaluation. We learn from that what works and what doesn't work, and then we start scaling up. So this is only possible because of the way we work as a community of practice, bringing together people and leaders from across AB InBev and from different organizations, so we make sure we deliver evidence-based solutions that are leveraged on technology, and of course we use the large footprint of AB InBev globally, operating in more than 50 countries and selling our products in more than 150.
Thank you. I'm going to come back to you in a minute and ask a little bit about the future of all this work. But first, Sam, I want to turn to you. Catalina mentioned the foundation and your unique role. I wanted to ask about that. Where does the foundation sit in this partnership? What unique qualities do you bring to this work?
Fantastic question. Thank you so much, John, and thank you, Tom and Kata. Very exciting discussion today. And to build off your question, we believe very strongly in the need for more partnerships and more collaboration if we're going to get serious about attacking and tackling and accomplishing the Sustainable Development Goals. And part of effective partnerships means having opportunities to bring complementary strengths together. And one of the examples we like to use is complementary strengths between a corporate and a foundation. There are things that are relevant to a corporate that it's best poised to address. And then there are complex challenges where a philanthropy, a foundation, has the best opportunity to address. So we believe that a foundation can look at those complex issues that might take a long time to investigate, that might require taking some risks on some uncertain things, diving in with academic rigor and research, co-designing programs with those who are leading the efforts on the ground, following up with rigorous monitoring and evaluation, and then identifying those programs that are proven, that are effective, that we can then turn back to our corporate partner and say, this now works, you can scale it up. So we serve to test and to prove, and then the corporate can work to scale that up. So at AB InBev Foundation, we work to catalyze innovative solutions to neglected challenges within the Sustainable Development Goals. And that means empowering change makers, organizations, and individuals with the resources that they need to bring their ideas to fruition. And this ESBI opportunity is a great example of that. It's a very cool concept that has a great deal of potential. And now we have an opportunity to test it under Tom's leadership, prove it with our partners at AB InBev, and then work with them to scale it up globally.
Great. Well, Tom, that brings me directly to you, of course. Why don't you tell people a little bit about ESBI, and including what those letters stand for, I think would be useful, and to make sure that we all understand that kind of the next level deeper of this work and the solutions it's going to enable.
Thank you, John. Really building on to what Sam mentioned, a screening and brief intervention for harmful alcohol use is an intervention that is known to work. There's a compelling body of evidence. The World Health Organization identifies it as an intervention that really works in reduction of harmful alcohol use. Unfortunately, this evidence-based intervention, which just basically entails asking a set of questions by a health provider, and then the health provider can determine the risk score of that patient or through a routine visit, and then give them appropriate care. Unfortunately, it's not really scaled up effectively. The reason is because it's expensive in terms of health worker time. You can imagine if you're in a busy outpatient setting, there's so many competing priorities. So we see the power of digital in bringing these to bear so that we can be able to free up the health worker time so that they can then be able to effectively advise the patients and then be able to reach those who need the care. This really sits in this aspect of bridging the health inequalities. Think about the way we are building these, the screening and brief intervention. As Kata mentioned, we have had experience in implementing these programs across different geographies, from Brazil to South Africa in the Alex Township in Johannesburg. We have implemented these in Mexico, Zacatecas, and also implementing in Zambia. These are places where you'll find a lot of health inequalities, and we recognize that even through the COVID pandemic, we were implementing these programs and we managed to learn through those lessons and then be able to take those lessons so that then we can build these aspects of going digital so that we can bring cost efficiencies to the programs that we're implementing so that they can be evidence-based. To what Sam mentioned, we are actually also doing a lot of rigorous measurement of this. We are going to do a number of studies which are actually published in peer-reviewed journals to give, so that other public health, within the public health community can learn about this and then be able to effectively scale up. So that's really what we're doing.
That's very exciting. Tom, if I could just stay with you, I want to ask a little bit of a follow-up question to that. Do you want to tell us anything else about the rollout that you just mentioned a number of geographies? What are the barriers you've had to address, and what you mentioned the lessons as well? Could you share a little bit of those lessons with the audiences?
Certainly, thanks, John. To what I mentioned, this is a very effective intervention which is known to work. The World Health Organization says in its safer initiatives, we need to scale these up. But unfortunately, it is expensive. So how can we use the lessons that we have learned through healthcare systems to leverage technology so that we can be able to ride on that mega trend of digital transformation so that then we can be able to reach those in need? We are already working in Sao Paulo, one of the largest cities in the world, in Brazil, which is 12 million inhabitants. And we are bringing this technology, and how we're doing this is we have partnered with the Office of the Mayor. The Mayor of Sao Paulo is really, really actively involved in this, in supporting this agenda. We have been able to build this digital solution where we have digitized these questions, the set of questions for screening and brief intervention, and then integrated this. We're not doing this alone, to what Kat and Sam were saying. We always partner with other stakeholders. And in that partnership, we want to integrate and not build a standalone solution, but something that is integrated within the healthcare system so that the over 2 million inhabitants of Sao Paulo can have access to these and be able to scale it up effectively so that they can be able to get access to the care they need. Yeah.
Great, thank you.
Thank you.
And Catalina, coming back to you, tell me about how you see the future of this program expanding and growing in the months and years to come.
Sure. Thank you, John. Looking ahead, we are planning to support the dissemination of ESBI through the AB InBev Foundation, and we are going to start in several countries. First in Zambia. As Tom said, we already started in Brazil. We're going to Colombia, to Mexico, and to South Africa. And we are also partnering with the United Nations Institute for Training and Research, UNITAR, to systematize all this knowledge, actions, and methodology in a very comprehensive toolkit, but very practical, to train health workers and make it available, free access to any government, any country around the world. And as we said before, SBI is part of SAFER, which is the set of recommended policies by the WHO to the governments. So it allows us to align with WHO objectives and with the United Nations Sustainable Development Goals.
Okay, thank you. Sam, if I could come to you again, I would love to hear your thoughts about how this approach could be broadened out to cover more of the SDGs and what you see your role perhaps at the foundation would be in doing so.
Fantastic question, John. I really appreciate that. I think this is a really interesting example of what we hope will be a new model that others will be interested in replicating. It's unique. Here you have a neglected global health challenge in alcohol consumption. You have an issue that's relevant to a corporate. You have a foundation that's well positioned and poised to add value to this ecosystem. And by working together to develop technology that will efficiently and effectively address this issue, we can then turn back to the corporate and to others to make it available globally to help tackle and overcome this neglected challenge. So we're taking something that is daunting, that is neglected, that is under-resourced, that is overlooked by most, and we're coming up with a solution through collaboration and technology that will be something that can be scaled globally. And it speaks to the power of effective partnerships and leveraging technology to reach massive scale. As we think about AB InBev Foundation outside of this initial project, we're going to take this example and use it in other ways ourselves. Across the organization, we focus on 5 broad pillars of work. Smart drinking is the core pillar for us, but we also have 4 additional pillars as we look at addressing neglected issues within the Sustainable Development Goals. One is social entrepreneurship. The second is water access. The third is sustainable agriculture and food security. And the fourth is disaster response and resilience. And for us, across all 5 of those pillars, we look at how can we infuse innovation, how can we empower women to ensure that we're addressing the most neglected issues, the most neglected challenges within each of those pillars, so that we can fill the global landscape, create a holistic approach, a holistic impact, and then ultimately work with the global community to achieve the Sustainable Development Goals. So taking this model, we can apply it to not only one part of our smart drinking pillar, we can also apply to other aspects within our smart drinking pillar as well. And so we'll be looking at what other innovative approaches can we leverage to help curtail harmful alcohol use, harmful alcohol consumption. How can we work with the corporate to identify the pain points that they might have that don't make sense for them to address, where we can leverage the philanthropic advantage to help them overcome. And so we're going to be looking at that across our smart drinking portfolio while we're working with the corporate to scale up the proven and best version of the ESBI. We'll also be looking at what else can we do in smart drinking. And then across the board in the other SDGs, we're going to be doing the same thing. And the whole time, we're going to be encouraging others to follow in our footsteps. Think about with whom you can collaborate. Think about the neglected issues that are out there in the space that you see, that your partners see. Build coalitions that are comprised of organizations and individuals with synergistic strengths, and leverage those to come together to test new things, to find those things that work, and then to scale them to create a holistic impact.
Thanks, Sam. We just have a couple minutes left. I thought maybe just as a quick concluding thoughts, we could go down the row. You know, Sam talked about taking this model and, you know, and maybe others are inspired to follow, or maybe they're doing something similar already. What are the key takeaways, or what is one key takeaway? Maybe I could ask each of you to give one key takeaway from what you've learned so far as you've advanced this approach. And we'll start with Tom, go to Catalina, and then Sam will let you wrap up.
Fantastic. Really, this is emblematic of partnership. For this to work, you need to partner with other stakeholders. If we're really focused on how we can work with others, and we're not doing this alone. We want to work with others, and this really is the way to go forward. Thank you.
What I can say is that solutions are out there, and we can work together to really address the challenges and help accelerate the United Nations Sustainable Development Goals. It's all about innovation, it's all about leveraging technology, and it's all about using evidence-based solutions, as we mentioned, and work as a community of practice.
That's great. I would say, building on what Tom and Kata said, I would say, think about the strategic role that foundations can play and the value that foundations can add to the complex challenges that the private sector might be facing. And don't be afraid to tackle those challenges head on, because when you think of responsible alcohol consumption, it might seem controversial, but at the end of the day, the programming that we're developing will save lives globally. And it's because of the approach that we're taking, it's because of the partners that we have at the table, and it's because we're not afraid to do the hard things, to try those things, to fail sometimes along the way, and then ultimately to work together to succeed.
Thank you so much. It's been a great panel. Partnerships, strategy that's informed by evidence-based research, and the unique role of philanthropy to address complex challenges, working with other partners. I really appreciate it, everyone. You know, find this team out in the hall, and find myself if you want to talk about this topic a little bit more, and we'll look forward to connecting with all of you later in the day. Thanks.